You know, we just talked about a flu season right around the corner, but don't make the flu the entire focus because it's really all respiratory illnesses. Doctors are monitoring a rise of a new COVID-19 variant. Along with this information comes a brand new survey which reveals many Americans are pretty hesitant about getting vaccinated from both the flu and COVID-19. Michael George breaks down that report.
I'm gonna pull this up.
Pascal Coromenos was first in line to receive the new updated COVID-19 vaccine.
I have 4 kids. I don't want them to get sick.
But not everyone may be so quick to roll up their sleeves this fall. A new survey from Ohio State Wexner Medical Center shows less than half of Americans are planning to get their COVID or flu shots this season.
Which is very concerning, as we really need a large majority of our population to get vaccinated to protect our entire community.
The national poll of more than 1,000 people found more than a third have gotten vaccines in the past but do not plan to this year. Infectious disease expert Dr. Nora Colburn reminds patients that getting the vaccines is critical. Updated COVID-19 shots and this year's flu shot are currently being rolled out.
It also protects you from complications of both infections. So we know that people who get influenza and COVID can have increased risk of bacterial infections, as well as cardiovascular events like heart attacks and strokes.
The survey found adults 65 and older are the most likely to get the recommended vaccines.
They're the most risk of getting severe disease, and we see that the vaccine really protects them from severe disease, hospitalization, and even death.
People with certain chronic medical conditions and pregnant women are also at high risk during respiratory virus season. So doctors say it's also important they receive these vaccines. Michael George, CBS News, New York.
The poll also found many Americans said they don't need other vaccines like the pneumococcal shot, which protects against pneumonia, meningitis, and sepsis. The RSV vaccine is also recommended. The survey did not, however, look into why so many have decided to forego shots this year. Well, doctors say the lack of people being vaccinated led to an increase in pediatric flu deaths last year. The CDC reported nearly 200 children died in the 2023-2024 flu season, which is the highest level since the 2019-2020 season. Officials say most children who died were eligible for a vaccine, but did not receive one.
Well, I think unfortunately coming out of the COVID pandemic, we have seen a rise in vaccine skepticism, people less willing to get vaccinated. And as we've seen with the pediatric flu vaccines, that has led to increased hospitalizations as well as unfortunately some deaths.
The American Academy of Pediatrics says your kid should get vaccinated for the flu, and ideally before the end of October, when flu season typically starts. Experts say children 6 months to 8 years old getting the flu vaccine for the first time will need 2 doses, at least 4 weeks apart. Now, as far as North Carolina goes, the state health department says there were 314 flu-related deaths last season. 16 of them were children under the age of 18. To compare that to previous seasons, like in 2019, 2020, there were 186 flu deaths. The next 2 seasons saw just 24 deaths total. The numbers dropped significantly as the country was masking up and isolating during the pandemic. Well, since we're on the subject of COVID-19 and the pandemic, let's look at this new variant. We're starting to see spreading of the virus slow down after that summer wave of infections peaked in August. However, the CDC estimates that the virus will likely climb again over the winter and peaking in mid-January.
When we get into our respiratory viral season, which starts in the second half of December, getting into January, our numbers will come back up again, not only for COVID, but also for flu and for RSV and our other viruses.
Well, as you keep hearing doctors say, the best way to protect yourself is simply to get vaccinated. But one question that keeps popping up, can you get the flu vaccine and the updated COVID vaccine at the very same time?
Walk into any pharmacy and you're probably inundated with advertisements urging you to get a flu shot and an updated COVID-19 vaccine. Several people on social media are wondering if it's safe to get both vaccines at the same time, or if they should space the 2 shots out. So let's verify. Can a person get the COVID-19 vaccine and the flu shot at the same time? Our sources are the Centers for Disease Control and Prevention, the Food and Drug Administration, Dr. Payal Kohli with the University of Colorado, and Dr. Sarah Lynn Mark, a former senior medical advisor to the White House. Traditionally, the flu vaccine is administered in the fall, ahead of peak flu season in the winter. We've also seen cases of COVID-19 spike during these same months as people gathered for the holidays. The CDC studied self-reported data from more than 92,000 people who received a booster shot and a flu shot during the 2021 flu season and concluded it is safe to administer both vaccines at the same time. The study found that about 10% more people who received both vaccines reported typical symptoms associated with them, like fatigue, headache, and muscle ache, than those who only received the COVID-19 booster. But the reactions were usually mild and went away quickly. So, yes, a person can get the COVID-19 vaccine and the flu shot at the same time. Both Drs. Coley and Mark tell Verify getting the two shots is more convenient and may encourage more people to get vaccinated against the flu and COVID-19. With your Verify, I'm Brandon Lewis.
The CDC says September and October are the best months to get your flu shot. Ideally, they say you should be vaccinated again by the end of October. Well, free COVID-19 test kits will soon be available once again. The test will be mailed to your home. Each household will be able to order as many as 4 swab tests. The U.S. Health and Human Services Agency hasn't given an exact date for when ordering can begin. And while we've been talking a lot about September and such, we are just 1 week away from October, which is Breast Cancer Awareness Month. The American Cancer Society confirms that breast cancer is the most common type of cancer in women in the U.S. They predict more than 310,000 new cases will be diagnosed this year. 6,000 women are diagnosed with breast cancer in North Carolina every year. Doctors say women 40 and older should be getting a mammogram each year to catch breast cancer early. Now, data shows a lot more women under the age of 40 are also being diagnosed with breast cancer. The American Cancer Society shows that between 2010 and 2019, there was an increase of 19% for people ages 30 to 39. Experts say there are several possible reasons for this trend, everything from risk factors like drinking and obesity to an increase in genetic testing to pinpoint the disease. If you missed any of this, you will be able to find it on our YouTube page. Just search WFMY. WFMY News 2 at 6 is coming up next.